So let's talk about the regular spine routine instruments first. So first, when you start practice, you need to buy your own instrument sets, as you don't get instruments in most of the hospitals. So you should have your own instrument sets. There are different kind of instruments, means you have to use orthopedic instruments in spine and special spine instruments. Orthopedic instruments like rongers, osteotomes, retractors, and special instruments like Kerrison punch, disc, penfield. So there are some blunt instruments, sharp instruments. Blunt instruments doesn't wear off, but sharp instruments wear off, like Keres and disc punches. So you need to replace these instruments. So you have to know which instruments to buy so they will last longer. So blunt instruments like Kerrison, the double-ended probe, penfield retractor, nerve hook, nerve root retractors, all these instruments, they don't wear off. So you don't have to bother about replacing them frequently. So now you have to think about the sharp instruments, which are nibblers, means rongers, the Kerrison punches, disc punches, bipolar forceps, all these wear off very quickly. So you have to know which instruments you have to buy. So you have to think about the first, Kerrison punches. The different kind of Kerrison punches, the different angle Kerrison punches will be there, like 45-degree angle, 90-degree angle, which Kerrison punches you need to buy. So you have to have at least 1, 2, 3 number Kerrison punches of 45-degree, and if you are well enough, you should buy a 90-degree for a lumbar spine. Then comes to disc forceps. Disc forceps comes, pituitary rongers are there, serrated disc punches are there. So you have to think of buying at least number 1, 2, 3 of each size. So another common spine instruments like penfield dissector, nerve root retractors, nerve hook, all these things which are not going to wear off quickly. You can buy a good means number of them because they are very cheap, and you can buy them means from any vendor, and these instruments don't wear off. So coming to the loops, Himanshu said me to talk about loops because loops is one of the important things. Loops are very important in magnification. Means I trained with microscope, but when I went to my practice, there was no microscope in most of the hospital. Again, a freelancing practice in Pimpri Chinchwad area in Pune. So I have to go and adapt to loops. So first thing I did was to buy a loop, because microdiscectomy or a cervical spine surgery without loops is difficult. So you have to buy a good quality loops. So I will talk about loops in detail after that. Then I shifted my practice to endoscopic spine surgery. So after a few years, but when I started shifting my practice from endoscopy surgery, I initially purchased a transforaminal scope because there was no RF. So I purchased my plasma RF. Then I purchased a drill. I purchased other endoscopy instruments. Then I thought ki this transforaminal is enough. Means I was not getting enough. Means I was not doing enough number of cases. So I wanted to do even a canal stenosis cases. So I shifted to biportal endoscopy. So then again I have to buy another set of instruments where I have to use them for a biportal endoscopy. So all these things you have to think. Then you have to buy a scope, you have to buy again everything if you shift from one kind of endoscopy to another kind of endoscopy. So you have to keep that in mind. Then burr. Burr is one of the essential part of your practice. Initially when I started my practice, I purchased a marathon burr which was not autoclavable. Then I shifted to one Olympus burr, which was a Indian-made burr, which was autoclavable. So I thought, okay, it will be very good for me because ETO at that time was not available. So I purchased that burr also. Then one of my friends said, why don't you buy a, means I started tubular, then they said, ki buy a Medtronics. So I purchased Midas Rex also, Medtronics burr. So then now I am started doing endoscopy. I asked Midas guys, Medtronics guy, can I use this burr in a endoscopy? They said, no, you cannot use this burr underwater. So then I have to think again about something. So another friend of mine said, ki you should go and buy an NSK which you can use underwater. So again I went and bought the NSK burr. So it's like I have now 3 burr sets. So 2 of them are lying in my cupboard. Another, the monoportal, this transforaminal scope and everything is in cupboard. So another one cupboard is full of instruments which I don't use. Then that's why you should buy a proper instruments at proper time. Don't be in a hurry to buy new instruments. but you should have most of your instruments with you, because with development of endoscopy and other specialty, like you just keep those instruments in cupboard. So my tubular dilator set is in cupboard, my transforaminal set is in cupboard, my two burr systems are in cupboard. Just I use only the NSK burr now because it is used underwater. So that's about the instruments. Then let's talk about the loops. Means when I started my practice, I was trained with Arvind Kulkarni sir with microscope. I never used loops, but I was used to magnification. So that's why I thought let's just go ahead with the loops. So loops are very important because they give magnification, but you have to keep in mind which loops you have to buy. So you have to keep these points in your mind when you are buying. So magnification power, the loops which are used in plastic surgery are different, cardiac surgery are different, spine surgery are different. Because of the magnification power, the working distance for them is different, for us is different. The field of view, depth of field is different. So you have to choose all these loops on basis of this frame type, declination angle, the light source compatibility. So choosing a right loop. So first 2.5, most of the senior surgeons tell us that buy a 2.5 loops, but they are good for a general use. In-depth use becomes a bit difficult with this, but as your magnification increases, the field of vision decreases, and the field of depth also decreases. So that's why you have to choose, most of the spine surgeons take around 3 to 3.5x loops because they have a good field of vision and depth of field. So that's why it is important. The 4x loops or a prismatic loops are very good for plastic surgeon and cardiac surgeons because they do microvascular work. So that's why it is important to choose a loop which gives a good field of vision, field of view, and good field of depth. So most of the loops you should choose with a range between 350 to 550. So my current loop is 3.5x, which is 450 to 550 mm, where I am very much comfortable. You have to choose the loop according to your neck angle, according to your comfort, according to your height. And the position should be comfortable. And you have to make sure that it is custom fit for your use. So what is field of view? Field of view means how much field you are able to see. So if magnification is significant, the field of view gets small. If loop is high definition, field of view is bigger compared to the normal loops. Depth of field means if you are able to see, means you are in spine, the depths are different. Spinous process is at different level, lamina is at different level, cord is at different level, and disc is at different level. When you see at the disc, and the upper part of a lamina and everything is blurred, so you can get a headache. So the depth of field should be good in loops while purchasing. So you can see you can see clearly the lamina, the dura, and the disc in at the same time. Otherwise, what happens? Lamina gets blurred and disc gets clear. So that should not happen. So that's why you have to use the loops. You have to take the test before purchase. So frame and mounting through the lens loops, which are the most preferred loops. These are numbered loops where IPD is fixed, intrapupillary distance is fixed. You cannot change it. It is specifically designed for you. And if you have a number, then you have to get it done properly with help of ophthalmologist. Another is flip-up loops. If you are not comfortable, if you want to use just normal spectacles instead of loops, then you should use this flip-up loops. The headband mounted loops. Some loops you can mount on headband with a headlight. These are lightweight loops. When you are doing long surgeries, it is very useful. But most of the people prefer this flip-up loops or TTL loops. So another point, illumination. The headlights are coming in the market from like this Integra headlight is something like 7.5 lakhs. but some headlights are very cheap. So you have to choose and you have to take a trial of headlight, because one of my colleague just purchased a light at 8,000 rupees headlight, but that is not very good. That is heavy with a less battery backup. So you have to choose the headlight with a good battery backup, which is lightweight and which is having 2 or 3 batteries. So this declination, ergonomically, you have to use this kind of loops where the loops are tilted. So if you are operating, your neck is like this, so your spine is going to go away. So these declination loops, which are available in market, you can use them. You can fix the angle according to your comfort. So you can operate like this when you are using the loops. So brand, there are different brands available, Carl Zeiss, Killer, Heine, all these brands are available. You have to choose according to your range, because all these brands which are good, you have to buy. Don't go for a dental loops or a ENT loops, because loops is one of the important investment in your practice. And definitely take a trial before buying it. Most of the loop people say we cannot give you a trial, but ask them for a trial. So this is a checklist for selection: correct magnification, a correct working distance, ergonomically fit loops. It should be tested by, means in a field of your surgery, means someone should recommend that, and the brand should be trusted. So borrow from your colleague and then check it and then take the loop. So, and last topic is just I have to tell you about the instruments used in unilateral biportal endoscopy, which I purchased recently. So this is OR setting where video trolley, C-arm is there, the scope is there. You should use all the shoulder instruments, equipments like burr, the shoulder scope, the RF, everything you can use from a shoulder guy or a knee scopy person. So some radio frequency probes are also similar to the shoulder people, and regular open spine instrument set is needed for a unilateral biportal endoscopy. So same scope, 30 degree or 0 degree you can use, where the field of vision changes. And there are some specialized instruments in a UB endoscopy, like drill, the introducer rod, then dilators. This dilators helps in creating a space above the lamina, so you can do the work with the help of these dilators. Then this muscle detacher, if the space is not enough, if water flow is not good, you can use this. The unilateral retractor working portal sleeves to make sure the outcome is good. Same open nerve root retractors. The angle retractor, you can use same retractor as of open surgery. Then the Penfield or a double-ended probe, the similar instruments you use for endoscopic spine surgery. So again, open chisels you can use in a unilateral biportal endoscopy. Open suction tip, you can use it. Similar Kerrison punches and everything. So almost all instruments of open surgery with a knee and shoulder arthroscopy set, you can perform a unilateral biportal endoscopy. So ASICON registration for Pune are open now. So kindly register. We will see you there. We would like to invite you there for this feast.